Good afternoon, and welcome to the Foundation for Healthy Kentucky's Health for a Change webinar. Today's webinar topic is self-care during a pandemic. My name is Rochelle Seeger. I work here at the Foundation for Healthy Kentucky. I have exactly the top of the hour. We'll wait just one more minute for folks to dial in and get onto our webinar here this afternoon. If for any reason you have audio problems through your computer speakers, I've sent out a message with the telephone and the password so that you can call in from a phone and listen to the audio via your phone. Great, I see a lot more people logging in. So thank you for joining us today on this webinar. I'm honored to work at the Foundation for Healthy Kentucky as a Community Health Research Officer here. And in my role, I work on the Foundation's data initiatives, and those include KentuckyHealthFacts.org, our data website, the annual Kentucky Health Issues Poll, and another main piece is this training series that we call Health for a Change. First, a bit about the Foundation for Healthy Kentucky. The Foundation's mission is to address the unmet health needs of Kentuckians. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. A reminder to everyone on the call today, this webinar is being recorded. On the Foundation for Healthy Kentucky's website, healthy-ky.org, you can find a lot of information about that foundation, including an archive of the Health for a Change training series, which would be under the Events tab, Health for a Change. Also on the Foundation website, you can nominate yourself or your colleagues in Kentucky for the Healthy Kentucky Policy Champion Award. And that's an award the Foundation offers to Kentuckians who are doing great work for health. That information is on the About Us tab. A reminder also, the slides and recording of this webinar will be posted to the Foundation's website very soon. If you're logged into the web portion, please do take time to chat in questions to us via the audience chat. We welcome your questions, comments, any problems with technical difficulties. I'm welcome to handle those via the audience chat. So please, throughout our webinar, please chat in questions to the presenters via the audience chat. Another of the Foundation's initiatives is the Coalition for a Smoke-Free Tomorrow. You can sign up for their newsletter and learn all about their work at smokefreetomorrow.org. And back to the reason why we're here today, the Health for Change training series. The Foundation for Healthy Kentucky has been offering these free trainings of webinars and workshops across Kentucky since 2011. The topics include things like grant writing workshops, coalition building, finding and using health data, infographics, and this topic, which is a great one and very important to us today, self-care. Again, website to find all of the information about Health for a Change, archive events and upcoming events at healthy-ky.org, events, Health for a Change. This Health for a Change training series has reached Kentuckians across all 120 Kentucky counties. Health for a Change happens because of great partnerships across the state. This slide shows photos from some events we held last year. In Whitesburg, we worked with the King Community Kitchen. In Allen County, we worked with Need More Acres Farm, with Michelle and Nathan Howell, as well as the Allen County Health Department and Allen County Schools. We've partnered with many other organizations like the Kentucky Center for Smoke-Free Policy and we've had topics including the 2020 U.S. Census and Jessica Bellamy's work on data infographics. Although we aren't offering CEUs on today's webinar, I'm happy to provide you with a certificate of attendance, and you can email me after the webinar today. We welcome your audience questions, so please chat those in. As I mentioned, Health for Change is about partnerships. And on today's webinar, we're partnering with the Bounce Coalition, and I'm pleased to welcome to the call Dr. Joe Barjone. Welcome.
Thank you, Rochelle. My name is Dr. Joe Barjone, and I'm a licensed psychologist and certified school psychologist. And I currently do work with the Bounce Coalition. And what I like to do is do some housekeeping things first before we actually get into the presentation. So a little bit more about myself. As I mentioned, I'm a psychologist. For approximately 25 years, I was the lead psychologist in the Jefferson County Public Schools in Louisville. And one of my responsibilities as the lead psychologist was to help that organization become trauma-informed. And so what we tried to do is create that framework of support to deal with children who are exposed to traumatic events. And many times we talk about adverse childhood experiences, or ACE. And so my responsibilities was to help the school district create that framework of support. In 2012, the Foundation for Healthy Kentucky put out grant proposals to work on childhood chronic illnesses. And in the Louisville community, we looked at our data, both educational data, public health data, and other data sources to look to see what do we want to focus on as a community to deal with chronic childhood illness. And what we landed upon back in 2012 was dealing with adverse childhood experiences, or ACE. And we knew that trauma has an impact on the children, both in the immediate and in the long term. And so what we did, and there's 17 organizations that are part of the Bounce Coalition in Louisville. And they go across the spectrum from education, out-of-school time providers, healthcare organizations, social services, advocacy. And so what we did for the first couple of years, we focused on 3 elementary schools in the Jefferson County Public School System to have them become more trauma-informed. One of the major pieces of that work was doing professional development similar to what we're doing today. Well, we collected data on the impact we were having on kids in the community and the school, and we saw some very positive findings at the end of that grant. Fortunately for us, at the Bounce Coalition, the Foundation for Healthy Kentucky said, hey, if you're able to do that and get those results in an urban setting, what would it be like if we set you up in a rural setting in Kentucky? And so they were nice enough to fund us for a couple more years. And so we landed in May of 2019. We partnered up with the Russell County Public Schools down in the south central part of the state. And we also would start to begin some work with the county health department in the Lake Cumberland region. So not only did that include the Russell County Public Health Department, the other 9 counties in the Lake Cumberland Health District. So we have been working with hand in hand with the school system and the health department in that community down the Lake Cumberland region. And so we just want to say, as the Bounce Coalition and as a member of the Executive Committee of Bounce, I want to thank the Foundation for Healthy Kentucky for believing in us and providing us the financial resources for us to be able to do this valuable work. Another partner we have as part of the Bounce Coalition is the Kentucky Youth Advocate. And so we have been working with them in partnership to get the word out about the work that Bounce is doing. So thanks to the Foundation for Healthy Kentucky and to the Kentucky Youth Advocate. So what does Bounce actually do? We have 4 key pillars or 4 key areas we work. The first one is helping organizations create that framework of support, and that's through professional development. So we've done a lot of professional development. We also are looking at the referral network that organizations can tap into if they need additional supports that they currently don't provide. The next one, it looks around advocacy and policy decision-making, and working with policy decision-makers to have a better impact on young people and families who are experiencing ACE events. And then the final piece of the work that Bounce does is measuring impact, the evaluation. Are the things we're doing to support organizations, whether they're educational or healthcare or social services or the court system, are the things we're providing working? Are they having a positive impact? So those are the 4 key pillars of Bounce. I appreciate everybody signing up for this presentation this afternoon. And between this afternoon's presentation and this morning's presentation, we had over 500 people throughout the state. In fact, we had some people from Indiana also participate in the morning session or the afternoon session. So we're very happy to have such a large number. When we looked at the data, the folks who are participating in today's webinars, they're coming from various organizations that intersect with families and kids. So the one major area we're looking at is schools, the educational system, and we have folks registered today from early childhood who provide services to early childhood kids. We have the K through 12 representation, higher education, including universities, regional universities, technical vocational schools. We also have a significant number of folks from the healthcare sector. So people who are working in hospitals, clinics, county mental health departments, the judicial system, that includes the office of the courts, juvenile justice, court advocates, folks who work in social services space, DCBS, CPS, behavioral health therapists, including psychologists, social workers, mental health practitioners. And then the last area where organizations that intersect with kids are the nonprofits. So you can just see by that we have a wide variety of folks in different agencies that work with kids and families. So we're excited to have such a diverse group of folks with us today. Before I go over the learning objectives, which you see up on your screen, I'd like to say just a couple more comments. We will be presenting on self-care and the impact COVID is having on people, increasing stress levels. One of the things, anytime I do a presentation about self-care or about mental health issues, I always talk about making sure we're taking care of ourselves, that's self-care. So if at any time during this presentation this afternoon, where something I say or some of the slides may create a strong emotional response with you, if you need to take a break, please do so. Couple options available to you if you need to take a break. One is to mute the audio section of this presentation so you can follow along with the PowerPoint, or if you want, you can even just step away from your laptop or your tablet for a couple of minutes to collect yourself and then come back to the training. But it's really important that folks be able to take care of themselves and practice those self-care strategies even during this presentation. As Rochelle was mentioned earlier, we do want folks to ask questions, and we've saved some time at the end of the presentation. So if you have some questions, please type them in the chat room, and we'll collect those, and hopefully I'll be able to answer those questions later. But I also want folks to we're talking about self-care today. Some folks in this webinar, you folks have some really great strategies already in place that are helping you to get through this pandemic. So if you feel comfortable, please type those things that are working for you, or if you have any ideas or suggestions, I would ask that you do that for us. That will help everybody. So with that being said, what do we hope to do or accomplish in the next 90 minutes? And we will end at 3:30 Eastern Standard Time. The first one, participants will learn the symptoms associated with stress. We'll also learn strategies to combat stress associated with COVID-19. We'll learn some strategies to become more resilient and how resiliency will impact us, and we can use that as a valuable resource for ourselves. And the fourth goal for us is learning the 3 key components of self-care. I know we have a fair amount of educators on the call this afternoon, and so it's the ABCs, what we hope to talk about self-care today. ABC stands for A stands for awareness, B stands for balance, and C stands for connectiveness or connection. And we'll talk more about that during the strategies portion of the presentation. And then the final goal we hope to achieve today, or the final objective, is for folks to be able to create their own self-care. When everybody registered for the event, some folks did mention that they already have a self-care plan in place, which I was happy to see. But then there are other folks who didn't have those. So if you are one of the folks who don't have a self-care plan, hopefully at the end of this presentation, you'll have some good resources and tools to create a self-care plan. Or if you're in the other group where you already have a self-care plan, maybe some of those resources and strategies that we're going to be talking about today, you might be able to incorporate into your current self-care. So with that being said, we are going to go to the next slide. And we're also at times during the presentation, we have a couple of polling or surveys we're going to do. And this is the first one. And so the polling question for you is, would you like to go back to your routine before COVID-19? So Rochelle's going to open up the polling, and we'll give you a short time to give us your response, and then Rochelle will show the results in a pie chart format. So I'll let Rochelle open up the poll.
Thanks so much, Joe. The poll is on your screen. We have a bunch of folks who have already completed it, and I'll leave the poll open just for a few more seconds. So if you want to enter your response. All right, so it looks like we have 67% answered yes, and about 33% answered no.
Okay. So according to the poll, and thank you to everyone in the audience for completing the poll, so about 2/3 of us would, if given the opportunity, we'd rather go back to our lifestyle or our life before the COVID-19 struck us about 2 to 3 months ago. Unfortunately, we're not going to be able to do that. But the reason why I put up this poll is the purpose is to show that regardless of our circumstances, many of us had a routine and structures in place, whether it revolved around school, work, or caregiving for our children or grandchildren. But a lot of that structure and those supports and those routines went out the window with COVID-19 and with us having to practice social distancing and then also sheltering at home, where many of us, we used to go out either to school if we were a student or if an adult, we go to our workplace. Well, all that has changed now, and so a lot of us are working from home, or some of us even lost our careers or our workspaces right now, so we're kind of struggling with that. So that routine of going to work and having a structure to the week has kind of gone out the window, and we've kind of had to reinvent ourselves. So with this slide here, I just kind of put up those three pictures as, the Monday morning blues, like, oh my God, here the work week begin, okay? And then come Wednesday for many of us, that was the middle of the week, and that was hump day. And then Friday, we always enjoy Fridays because that's finally Friday, and then the work week has ended, and now we have the weekend to do things that we enjoy doing outside of work, doing things with our family, with our loved ones, and with our friends. So with COVID, it has really taken that system we've all put in place and kind of turned it on its head. And a lot of those, I call them markers, a lot of those markers have gone away, and we have to recreate a new system of support or a new framework of structure to deal with that. That loss of routine and structures has caused a significant amount of emotional responses in many of us, okay? And so what I'd like to do now is to go to the next item or the next PowerPoint slide, which I think is up there now. And so we're going to do a second poll. And the question to the second poll is, does the pandemic make you feel this way? And if you're not able to see clearly what's in the bubble on the cartoon says, I think it's stress. So Rochelle's going to open up the poll or the survey, and if you would, please respond to the question.
Thanks to everyone who's sent in their poll results already. I'll leave the survey open just for a couple more seconds if you want to chime in your response. All right. Here are the results. About 77% answered yes, and about 23% answered no.
Okay. And thank you for completing the poll, everyone. And those results are pretty comparable to what we actually found this morning when we did this survey with the folks earlier today, that 3/4 of us in the audience today are feeling significant levels of stress due to the COVID. And so we know, that's part of this pandemic. So we're going to be talking more about stress in a little bit, but I just want to do some using some basic terminology around the pandemic. I think for many of us, up until 2 to 3 months ago, we kind of knew what pandemics were, but we really never, for many of us, we didn't experience that firsthand. So I just wanted to put up this definition on the webinar today. It explains what a pandemic is versus an epidemic. But some of the big pandemics that some of us have went through, probably the only one that most of us are aware of that has been in our lifetime, regardless how old you are, was the HIV/AIDS pandemic that was a while back. The one that we're seeing a lot of these days that they're talking about, especially when many of the folks today are from Kentucky, so Governor Brashear, our governor, does a talk at 5 o'clock, give everybody an update on what's going on. And the pandemic he always references in his presentation at 5 o'clock is the flu pandemic of 1918. And he uses that as the example of flattening the curve. Until 2 months ago, many of us didn't understand what flattening the curve is. But I think if we did another survey now or did another poll now, our everybody's ability to articulate what flattening the curve is probably, if not 100%, very close to it. But what Governor Brashear did in his presentation talks about flattening curve, and we want to be more like Philadelphia versus St. Louis. And then the last big pandemic, this is way before any of us were born, but in the 13th century, they had the bubonic plague that really kind of ravaged much of the world and the people who lived during the 13th century. So that's a little bit about pandemics. And with this next slide that you now see on your screen, this comes from the Centers for Disease Control. In fact, a few of the next slide also comes from the Centers for Disease Control in Atlanta. But this is how do we stop the spread? I think if we did another polling now, many of us would be able to recite these or identify these. But I just want to touch upon some of these real quick. We know if we're going to cough or sneeze, we use a tissue. If not, then we cough into our elbow. That's a way of dealing with. Clean and disinfect frequently touched objects and surfaces. I think when this pandemic first hit, and if anybody in the audience was doing the grocery shopping for the family, 3 things went quickly in our local grocery. The 2 involved paper, both toilet paper and paper towels. And the 3rd product that went very quickly was like hand sanitizer and cleaning products and to wipe down objects and surfaces. And those went very quickly. Hopefully now in your communities, many of those products are now in better supplies and we have better access to those. The next one in that column on the right is washing our hands for at least 20 seconds. As I mentioned earlier, I'm a school psychologist by training, and I had spent close to 30 years in schools, and much of my work was in elementary school. And when they started to do the 20 seconds, that we should always wash our hands for 20 seconds, it brought me back to the days when I'd be in an elementary school, and I'd be walking down the hallway where it was either the kindergarten class or early childhood or first grade class. And all of a sudden you hear children singing the birthday song. They might be in their room where they have in their classroom where they might have a sink in the back, or it might be coming out of the boys' room or the girls' room. And I always wonder what's going on. And if you remember from those days, and I know we have some elementary education teachers on the webinar today, is when we teach children how to clean their hands, a good hand hygiene, we tell them to sing the birthday song twice, and that comes out to be about 20 seconds. So this day, even now, sometimes when I wash my hands, I'm starting to sing the birthday song in my head. A couple of the other ones that we talk about is avoiding close contact with others who might be sick, and that's that social distancing, and we'll talk more about that. And then staying at home if we're sick. And then the last one is in the middle on the left-hand side, avoiding touching your eyes, your nose, or your mouth, right? So those are some of the things we do to avoid spreading the germ. What's kind of interesting with that one slide about avoid touching your eyes, your nose, and mouth, one of the adaptive skills, I know when I'm stressed, in years past, when I'm stressed, I would be a nail biter. And that was one of the symptoms I had, or one of the behaviors I did to reduce some of the stress that I have. And I'm sure some people in the audience probably shaking their head at this point and say, yeah, I'm a nail biter. Well, that adaptive skill or that adaptive behavior of nail biting to reduce the stress in the current pandemic situation is not something that we should be doing. And I think this next slide that I'm going to put up really kind of typifies why we shouldn't be biting our fingernails or putting our hands to our face. So if you're not able to see in the cartoon, you see, don't touch your face, but then the person says, how am I supposed to bite my finger as an adaptive device to reduce stress? But this really begins the conversation around stress and the different ways we're going to deal with stress. But I think in the beginning of this conversation around stress, we should talk about what is stress like during the pandemic or during an outbreak. And once again, the information in these next 2 or 3 slides comes from the Centers for Disease Control. So in this slide, you see stress during an infectious disease outbreak can include fear or worrying about one's own health or the health of loved ones, changes in sleep or eating patterns, difficulty sleeping, worsening chronic health conditioning, or worsening mental health issues, and then also increasing alcohol, tobacco, or drug use. And just from my own perspective, from my own life, when we're talking about eating habits, I know many of us will tend to eat more than we did on a regular when we weren't in this stressful situation during the pandemic, or some of us are eating less. Then the other thing is many of us are reaching towards what I call comfort food. And a lot of times with comfort food, we thought to get those comfort foods when we were children. So I know me personally, I've really started to, it's been quite a while since I had tomato soup and a grilled cheese sandwich. But I'd say over the last 2 months or so, I've had a number of times for lunch or even for dinner, I'm having, grilled cheese sandwiches and tomato soup because that provided comfort to me as an emotional comfort for me. For other folks, it might be mashed potatoes or macaroni and cheese, but any of those comfort foods. And so I would assume many of us on the call today during this webinar are experiencing the need or craving for some of the comfort. We're also looking for our own health and the health of loved ones. And I think where we become stressful about that is if you're the individual in your family where you may have to go to the grocery store and do the shopping, and all of a sudden you see somebody walking around without a mask and they sneeze or they cough and they don't have a tissue or they don't cough or sneeze into their elbow, and it brings you back like, oh my God, I hope I don't contract COVID-19 from that person not practicing good hygiene. So we know some of that. And then the last point I want to bring up and discuss a little bit further detail is about sleep hygiene. And when we're talking about sleep hygiene, some people have more difficulty falling asleep or staying asleep, where you have a much more restless sleep during the night, or sometimes we're not sleeping enough, or even times where we're sleeping much more. And those are all signs of that we're under a stressful situation. So what groups of folks who might be more at risk in these stressful situations will have a stronger response, and that's what's in this slide. So we know that older individuals and people with chronic diseases are at a higher risk for severe illness that could be related, that COVID-19 that impacts them. Children and teens, they are not being as much affected by COVID-19 on the physical side, but I believe that they're experiencing a higher level of stress themselves and seeing those people around them having a higher level of stress. And then their routines and structures that they had in place, for example, going to school 5 days a week, they're no longer doing that, and now their whole lives are upside down. So that's creating a more stressful situation for teens and for children. And the next group are those are what I call the helpers, and how COVID-19 is impacting those. So those include the doctors and nurses, healthcare providers, EMS workers, first responders. But I also think it's having a stressful impact on our educators. As teachers and counselors and principals and assistant principals and bus drivers, that our routines have kind of gone upside down too. And I know many teachers across the state and in all 175 school districts, we're doing the school support or school education, the academics through NTI, non-traditional instruction. But not only are schools doing the academic side, but now they're trying to reduce the stress by providing some social emotional support. Some school districts around the state are really doing a great job that even though we don't have contact face to face with our children and our families, we're finding creative ways of using social media and social platforms to be able to address the social emotional needs of kids and families. I also just want to draw your attention to under first responders and doctors how it's impacting us. Unfortunately, it's having some serious impact on some of our healthcare providers. And I use this as the example. I think it was about 2 weeks ago on the national news when I was watching it one evening. They had a remote from a New York City hospital. An emergency room doctor was really having a difficult time dealing with the stress of trying to provide care to so many sick people who were critically ill. And then, unfortunately, if you followed the same story, you know that doctor died by suicide. That person took their own life. And then there were other situations of first responders, of EMS workers, of firefighters who were providing those services. They unfortunately made the decision that life was too great or too difficult for them due to the stress, and they also took their lives. So that's why it's so important. I'm happy to do the presentation today to deal with self-care, because whether I'm a first responder in the healthcare setting or in the educational setting, if I'm a teacher or another school employee, or if I'm working social services, if I'm a DCBS worker or a social worker, these times create a lot more stress on us as we try to provide support to our clients, our families, and children working. And then the final group of folks who are struggling with the stress under these difficult times are those folks who have pre-existing mental health conditions. Okay, so if I already have an anxiety disorder or depression, throwing the COVID-19 on top of that has really thrown a lot of our friends and colleagues and loved ones into a more severe state around social emotional issues. And then, unfortunately, some of those folks are going towards using substances, whether they're prescription drugs or illicit drugs or alcohol or other inappropriate things. So I think those are some of the stressful situations. What I'd like to do now is to talk a little bit about what are some of the things we can do to address this stress, or coping with stress. And so on this slide, you'll see some examples, and we'll go into some of these in more detail later in the presentation. But this first one is taking breaks, watching TV or reading or listening to the news or being on social media, whether that's Facebook or Twitter or whatever social media platforms you're using during the pandemic. Because many of us, unfortunately, if you're watching TV all the time or on social media, you can do that 24 hours a day, 7 days a week. And that is not healthy for us. So taking a break from social media and watching TV is important. The next one is taking care of our bodies. And you can see there is about taking deep breaths and stretching and meditating. And later in the presentation, we'll go in more detail about some of those strategies. The next one is exercising and getting plenty of sleep, avoiding alcohol, and then also now making time to unwind. Try to do some other activities that you enjoy doing. And I know with some people, in some communities, there's been an increase in people buying puzzles and doing puzzles together as a family, and we'll touch upon that a little bit. And then the last point on this slide talks about connecting with others and talking with people you trust about your concerns and how you're feeling. So that could be a loved one or a family member or a colleague or someone, a faith leader. It could be your pastor or your minister at your church or your house of worship. I think in the past, a lot of us, when we would look at that, it was always face-to-face when we're dealing with these stressful situations. But now a lot of us having to use Zoom. And as I mentioned earlier, that up until 2 months ago, most of us never participated in a Zoom meeting. And now many of us are probably experts in how to conduct Zoom meetings. And I just want to circle back to the exercise one. When everybody registered for this afternoon session or the session in the morning, and there was a question in there about self-care practices, the one activity that had the highest response was on the physical health. It involved exercise. And I know I've tried to be more mindful about doing exercising myself during this pandemic. But I think sometimes we can take it to the extreme by doing exercising. And so sometimes it can actually have a negative consequence on us, but it also can have a negative consequence on those people around us or those other folks around us who are having a negative impact are exercising on them. And so in this next slide, hopefully you're able to see it. In case you can't read the text, it says, please don't walk me again. Find something to watch on Netflix, read a book, but leave me alone. And I really love this because I know a lot of us, especially when I go walking in my park near my house, I see so many individuals with their family members and their pets, walking. So I think this is a great example that sometimes we got to be mindful how exercising could impact those around us, especially our pets. So, but I do think that's really important that we do practice exercise. Okay. With that being said, many of us, like I said, up until about 2 months ago, if we would start talking about social distancing, we would not know what that terminology meant. But you can see on this slide that social distancing doesn't equal or equate to social isolation. Okay, and in my mind, I think social distancing, I think a better description of that, and you see that in parentheses, is physical distancing. And we want to be 6 feet away from each other. And in this slide, I think this really captures. You see a child here measuring 6 feet with a tape measure between himself and his toys and stuffed animals, and that's 6 feet. So we know that is one of the key things. Social distancing is making sure we're keeping 6 feet apart from one another. Okay. What I'd like to do in the next slide is talk about a little bit about that social distancing, but staying connected. And so on this PowerPoint slide, you see 2 pictures. The picture on the left is actually really positive messaging that they're doing in the park where I do a lot of my walking near my house. And so you can see the tagline at the bottom. You see the rainbow, and it says, please walk 6 feet apart in the rainbow. And then together we are Kentucky. And some of this messaging on the sidewalks where people draw in chalk, I've seen a number of those that telling everybody what 6 feet is. So on other ones, I didn't include those pictures on this PowerPoint, but I saw, what is 6 feet? 6 feet in this park is if you lined up 12 green turtles next to each other, that's 6 feet. Or if you had 2 otters standing next to each other, side by side, that's 6 feet. Or in our community, in our park where I walk, we have a pair of bald eagles. And if a bald eagle spread its wings, that equals 6 feet. So that's a good way of staying connected and having positive messages and positive reminders about what social distancing is. At the same time, when we're looking at social distancing, it brings me to the attention of the slide on the right about even though we're practicing social distancing or physical distancing, it's important that we stay connected, right? And so hopefully you're able to see on this slide, you see a log, and then on the log there's a small stone, and somebody picked up that stone at one point and painted that slogan, Team Kentucky with a smiley face. And then they had to bring that back to the park and put that on that log in that walking area or on that trail that I was walking. And on the day when I was walking, there may have been 100 people who walked past that log and that rock. And maybe only half of us saw the rock, Team Kentucky. But it really meant a lot to me. When I saw that, it was like out of the blue and made me smile and realize even though I'm by myself walking and practicing social distancing, I'm still staying connected. And that person, whoever drew that, painted that rock, Team Kentucky, it really made me feel connected to my community. And so I thought that was a really nice thing that some folks are doing. The other thing that I know some people around the Commonwealth of Kentucky are doing, and this comes from the governor, where many of us at night, when we're turning on our porch lights, we've replaced the clear bulbs with green bulbs. And so when it gets night, instead of having a clear light, you see a green light. And what Governor Beshear talked about was green stands for compassion and renewal. And that was really a way of showing respect for, right now there's over 250 Kentuckians, our loved ones and colleagues and friends who have lost their lives to the COVID-19 pandemic. But I do like that idea of turning on the lights and making us, even though we're social distancing from others, as a community, we're trying to stay together and comfort each other. So those are just some good messages around social distancing while at the same time practicing that connectiveness in our community. So at this point, what I'd like to do is to kind of get into a little bit of conversation around resiliency and then some self-care practice. And I think this picture where you see a picture of a flower that's blooming, it's in the middle of a sidewalk where there was a crack. And so despite that being in not a lot of dirt and not a lot of nutrients and maybe a minimum amount of water, that plant was able to grow and flourish to the point where now you see this, three beautiful purple flowers and a little yellow in there, that despite the circumstances where that seed landed, it was able to pull all its resources together, whether it was water or nutrients in the dirt, pull that all together to grow and then to actually flourish. And I think that's a great example of resiliency. And that's one of the things what we need to do, both for ourselves, become resilient individuals, resilient families, and resilient communities, is pull together all our resources to build that resiliency in us. Because that will help us in the immediate situation with us dealing with the COVID-19 pandemic. But the more resiliency we have, even when we can get through this period with the pandemic, that those resiliency skills will help us overcome negative events in our lives moving forward. So we're going to spend a few minutes now talking more about resiliency and strategies we can do to build our resiliency skills. In this next slide, I think this is a good slide I like to show. It's a Japanese proverb about resiliency. And it says, never give up. We may fall down 7 times, but we get up 8 times. And I really like that we are going to bounce back from whatever events we're challenged with, faced with, especially with the pandemic. That if we have good resiliency skills and rely on those along with self-care, we're going to be able to get this together. If some folks like to know what the exact definition of resiliency is, and this comes from the Merriam-Webster Dictionary. And so the definition of resiliency is it's the ability to recover from or adjust easily to adversity or change. And obviously with the pandemic, COVID-19, that is a major adversity that we're all experiencing. But resiliency is one of the key things we should do to overcome the impact of the stress that the pandemic has on us. And so in this next slide, these are 10 personal ways to build resiliency skills. And I bet you if we did a survey now, if I did a polling, and I'd ask, are you practicing some of these? Probably many of us are already doing some of these, but there may be some that you folks haven't thought about. And so hopefully when you leave us this afternoon and you reflect on the presentation, you might say, hey, listen, I got that piece. I'm really good about, working towards goals or doing some self-nurturing, but I'm having difficulty making connections. So hopefully this presentation will give you some ideas on how to build those other personal resilience skills that we should try and incorporate into our living. So what I'd like to do is just to spend a couple of moments and give you maybe a few examples for each of those. So for example, making connections. When we talk about making connections, that's making connections with loved ones, friends, as well as colleagues and other folks in the community. And I know many of us now are already doing that. So continue to make those connections and to rely on those connections. In self-discovery, learning more about ourselves. And I know a lot of my friends, some of the people I have contact with, a lot more folks are doing diaries. They're journaling at this point, and they're putting their thoughts and ideas and their feelings down on paper. Or if you may have a word processor, you may type those using a word processor. But that helps you kind of do some self-discovery or reflecting on your own life. So I think that's a real key strategy to build resiliency, whereas many of us may have not thought about that in the past, but that might be something folks may want to try. The next one is accepting and managing change. And I give you the 2 examples. The barn door is open and the horses have left the barn. Or the toothpaste has come out of the tube. You can't put the toothpaste back in the tube. Okay? We know that COVID is here. COVID-19 is here, and it's going to be with us a while. So now what we have to do is accept that, and it has forced us to make changes in our lives, the way we interact with others, the way we can. So one important resiliency strategy is accepting and managing change. And then the next one is keeping things in perspective and making sure we're maintaining balance. I know this is a very, very stressful time for many of us, but we kind of have to keep that in perspective. And then taking decisive actions. And I think I kind of bring that back with that one, taking decisive actions and moving towards goals. That brings me back to on January 1st of each year, I think myself, along with many people around the world, we do New Year's resolutions, and many of us are going to say, I'm going to exercise more, or I'm going to lose weight. Okay, great goals to work on, resolutions and stuff. But many times we may even develop a plan, but we don't execute it, right? And we don't take decisive action. So that's one of the things we need to be a little bit more definitive about to do that. And then if we do establish goals, they need to be measurable. So moving towards goals, it just shouldn't be, I'm going to exercise more, okay? Now, for some of us, I think it's better instead of saying I'm going to exercise more, is actually be a little bit more at the granular level and say, I'm going to exercise more, and this is what it's going to look like. So it may be in the beginning is I'm going to take a 30-minute walk 3 days a week, right? So that is exercise. And then it may be I'm going to do that for 2 weeks and then reassess. And now I may take a walk for 30 minutes 5 days a week. So you want to make sure you're moving towards the goal, but you want to make sure the goal is measurable, okay, and it's reachable. I think sometimes we fantasize, I'm going to lose 20 pounds or I'm going to lose 30 pounds, and I'm going to lose it by the end of January. And I think if the goals are unrealistic, as soon as you get on the scale and you don't see the weight loss you want, you get frustrated and then you give up and then you don't follow through with the goals. So that's why it's important that whatever goals you choose to do, that they're specific and they're realistic, okay? And you might even think about doing like short-term goals, and then those short-term goals lead to a longer-term goal. So that's a way of working towards goals. And then nurturing your self-esteem, taking care of yourself. There are going to be times that we all have bad days, right? Whether it's work-related or I'm the primary caregiver in my family, and I'm having a bad day because now I have to I'm homeschooling my child, I'm the teacher, and I'm also now I have to adjust to working at home. And so we're not nurturing ourselves. So the important thing is that we don't want to beat ourselves up and accept that not every day is going to be great. And there's a great line that goes along these lines. Don't let greatness get in the way of being good. Okay, so if you're having good days 4 out of 5 days and that fifth day is not good, that's okay. Okay, because that would impact our self-esteem and nurturing ourselves, because we have to take care of ourselves if we want to take care of ourselves. The next one revolves around maintaining hope and positivity. And I use this as the example is, although none of us predicted that the pandemic was going to impact us, but it actually has made many of our families closer together, because many of us, we are now stuck in our homes together, right, where we're quarantined together. So now there are some opportunities for some of us to be able to do things together. And as I think I mentioned earlier in the presentation, there's been a significant increase in puzzle sales. And so many of us, and multi-generational folks doing it in the same family where they're doing puzzles together. And it's drawing a lot of families closer together and creating some bonding. So that I think that's. And then with the next slide is taking care of oneself. We'll talk more later about self-care strategy to deal with the way we're feeling. And then the last one is building personal resiliency, deals with seeing crises as surmountable problems. Okay, and I think if you're watching TV or listening to the radio, many of the commercials you're seeing on TV and listening to the radio, we don't see as wide variety of commercials anymore. So a lot of times now the commercials that we're seeing on TV are either from delivery services like UPS or the ones who deliver food, or other organizations where they're bringing things into the home. Okay, and at the end of each commercial, a lot of them say, "And we're in this together." Okay, which is bringing that connection to everybody, and it makes the problem that we're faced with more. Seems like we're able to overcome it because we're all together. So I think a lot of those commercials are using that message that, us being together and being resilient, we're going to be able to overcome that, and that life could be tough, but we're tougher. And that really brings me to a situation in this past fall. I'm doing some work with the Gallatin County School District up in northern Kentucky, and I was in the middle school one day, and I was coming in to talk with the teachers, and I walked in the main lobby, and in a lot of schools they have the posters and the flags up with some inspirational messaging for the students and the staff. And on the messaging at this middle school, it says, on the poster, it says, "Life is tough, but so are you." And that really kind of captures in my mind about seeing a crisis, being able to overcome those crises. So I think if as you look at these 10 ways of building resiliency, hopefully some of you folks are using many of these. And if you're not using some, I challenge you after this presentation is over to maybe pick one or two of the other ones that you're not trying, and then put something in place in using those resiliency skills. Because resiliency really is one of the key factors for us in order to be able to overcome the impact of the stress from the pandemic that we're in. This next slide that's coming up, I like this because it kind of goes towards the beginning of our conversation around self-care. And it's like you cannot pour from an empty cup. You must fill your cup first. And I just really like that saying. When we're talking about self-care, if you would go onto the internet and just type in self-care or self-care plan, there are a gazillion of those out there right now. And there's research behind different ones. And when I was getting ready for this presentation, I was looking at the literature about self-care and the different practices, self-care plans. I was able to boil it down to three key ingredients, regardless of kind of self-care you're going to practice, or practices, or the plan you're going to put in place. They boil down to the three key ingredients, and that comes to the ABCs, as I mentioned earlier. And so for some of our educators, the ABCs they're familiar with, but these ABCs stand for A, ingredient, part of this conversation. So with awareness, what we're talking here about awareness is awareness of your own stress level. Okay, are you able to identify the level of stress that you're having? What does it look like in you? And that's going to be different for each person, whether it's behaviors or symptoms. So what does stress look like in you may be different than the way it's being evidenced in your spouse or your loved one or your friends or your children or the people you're serving. But what is your stress, and what does it look like in yourself? Okay, because it is going to be different for everyone. And then also the triggers. What triggers a stress-related situation for you? Okay, and knowing what your triggers are. So that awareness is really an important ingredient. Another example I can give about your own awareness, how your body may be reacting to that, or social emotional standpoint, how are you reacting to stress? And the example I can offer to everyone in our audience today is, if you ever had to have surgery in a hospital, after surgery is over and you're in recovery, or you're in your room, and the hospital staff, the doctor or the nurse comes up to you and says, "Hey, how's the pain? From 1 to 10, can you tell me your pain level?" Because then they can adjust the medication. That is a perfect example of what awareness is. So being in tune with your body, both from a physical perspective, then also from a social emotional perspective. Okay. So awareness is the first key ingredient to good self-care. The next key point, self-care, is balance, and that's B. And in this slide, what you'll see, balance, it's balance. In the middle of that slide, you see that's the scales of justice. And what you really want to do is have balance among four big areas of many people's lives. So in the top left-hand corner, you see the person working on a laptop. That represents work. If you move over to the right side on the top, that family, that represents family. That's part of our life balance. And then the bottom right-hand corner, doing that parasailing, that represents leisure and doing fun activities. And in the bottom left-hand corner, hopefully you're able to see that, but if it's not clear to you, that's rest and sleep. So you actually see two young people sleeping, and between the two young people, there's a dog sleeping. So it's really important that we have rest. I show this slide about balance because we're never always going to be in perfect balance, okay? There may be times, like at work, if you have a time-sensitive activity or responsibility at work, what may happen in a short period of time is you may have to spend more time at work or completing that work, and that takes time away from maybe interacting with your family or doing leisure activity, or maybe not sleeping or getting as much rest as you should be. That's going to happen even when this pandemic goes away. We're all still going to experience that. There are times when we're going to be a little unbalanced. But the important thing is, if we're always out of balance, that can really have a negative impact. And that's what we have to try and do is, I used to do a lot of exercise. I may not do parasailing, but, up until this pandemic, I was exercising, going for walks 3 days a week. and now I'm so stressed out with work, or I'm not employed, I'm looking for work. Now I'm not doing my exercise as much as I should. So in the short term, that it's a fact of life. We're going to be out of sorts, and we're not balanced. But if it's going now into weeks and we're still out of sorts and we're not balancing it back, and we're not incorporating more fun things to do with family or your sleep or recreational activity, it's really important that you try and recalibrate to deal with that, because balance really is a key piece to our ABCs of self-care. And then the C in the ABCs is connectivity, connection, building supportive relationships. And so when I'm talking about relationships, I'm talking both not only with family members and our loved ones, people close to us, but even about the community. But on this slide, I think this really represents our connections to our family. So if you look in the slide, the picture on the left, I'm going to say it's a family having a Sunday meal together. So you might see three generations of people there. You might see the grandparents, the parents, and then the grandchildren, children. And they're all sharing a meal together. In my mind, that's a very positive experience, and that's a great connection. So many of us, because when we have to practice social distancing, not everybody lives on the same roof. So it may be now with grandma and grandpa, because they're over 65, we can't spend time with them because they're living on their own. So what do families do to have that connectivity with family members? And so many of us are doing Zoom meetings, family meetings. In fact, I'm doing that fairly regularly with my own family. With my own family, I have nieces and nephews and siblings who live all across the United States. So obviously it's not feasible for us to stay connected in person, but we're using Zoom meetings to stay connected as a family. Now, most times with families, when you're looking at having a meal together, when families are connected, that's a positive thing. But for some families where there may be a lot of dysfunction or possibly domestic violence, now that we're all in the house together and we don't have an out where I can go to work and get some relief being at work and not focusing on my family, or if I'm a child, not being able to go to school and get some relief at school, that can create some stressful situations. So it's, for most people, being together as a family is positive, but we have to be mindful of if you're providing supports to families and kids as a provider, whatever setting you work in, that sometimes being with your family 24 hours a day is not a positive experience. So I just want people to be mindful of that. And then in that second slide, because we're all not together, we're now doing Zoom meetings as a way of connecting with our family and loved ones. And then the last slide on the right, or the last picture on the right, is another way of us connecting with others, is many of us are texting each other and seeing how everybody's doing. So those are just some examples of what we can do as families. And I know with some families, and we'll talk more about this in a little bit, about self-care, is if we're doing Zoom meetings, of having fun things to do. And I'll share a little bit more, some examples later, but one of the things some families start to do, I've learned about, is they're playing charades on in family Zoom meetings. And I thought that was a neat thing to do, or Family Feud, that TV game, that they've been creative enough to be able to do that. So I thought that was a really good idea. So that's a way to stay connected with our families, but also it's important that we stay connected as community. And what I like to do, and I'll talk about these for a moment. The picture on the left on this slide is, I think it's the Big Four Bridge in Louisville, where I live. And we know that green is the color of compassion and renewal that we're trying to demonstrate in practice in Louisville. And I really like that the community, it also makes the connection. If you live out in the state and you haven't had the opportunity to visit Louisville, that bridge connects Kentucky to Indiana. So that's another way of making that connection in a community. And that's why I really like what bridges represent. So that's a great thing, a great way of showing community connection. And then just for a moment, I'm going to ask Rochelle to show the video. And this is a 30-second video of communities coming together and acknowledging those first responders, especially in the healthcare profession. And so I know in this presentation today, we have some folks in the Lake Cumberland Health District, in the Lake Cumberland region. And so in this video, this is why I like this picture so much, or this brief video, is it's showing the community comes together and showing that they care and they appreciate the services of our healthcare providers, our doctors and nurses, and other health officials at the hospital. And this is actually in the Lake Cumberland Regional Hospital in Pulaski County in Somerset. So it's a 30-second video, and Rochelle, if you would just play that video, that'd be great. Thank you, Rochelle. And as I mentioned earlier, what I really like about that is that this comes from a rural community or a smaller community population-wise, because if many of us are watching TV, when they're showing acknowledgement of folks who are working on the front lines, whether the healthcare providers or even law enforcement or EMS, they tend to always pick large cities or urban areas. And I like this, that in Pulaski County, Somerset, that the law enforcement officials from the state police to the sheriff's department, local law enforcement, they all came together in the parking lot to recognize and show their appreciation for the healthcare providers who are taking care of our folks who've contracted the virus. So those are just some examples of community connections. And what I'd like to do now is actually talk about that self-care plan. So we talked about connectiveness, we talked about the ABCs, and we talked about resiliency. And let's kind of spend some time on self-care. And this is where we're going to take another poll, okay? And this is my self-care plan, and there are 5 sections to this. And you're going to, in just a moment, Rochelle's going to open up the poll, and we want you just to check off which of these areas you have an activity or a thing that you're doing to address those areas. So if you look in the upper right-hand corner, that is, I will improve my physical health by, and you may have some things like doing exercise, walking, or riding your bike. Then in the upper right-hand corner, I will improve my social and emotional health by, list resources of the activities or habits you have. The bottom left-hand is I will improve my spiritual health by, whatever those are. And then I will improve my lifestyle, the bottom middle. To the right at the bottom is I will improve my social people connections by. So Rochelle is going to open the poll now, and if you would take a couple seconds to complete the poll, it'd be much appreciated.
All right, we'll leave the poll open just for a few more seconds. So if you would check those boxes. Great, seeing a great turnout. All right, last call, folks. I'll send you the results and the survey. So those results look like about 61% marked physical health, 68% marked mental emotional health, 64% marked spiritual health, 42% marked lifestyle, and 68% marked the last category, social and people connections.
Thank you, Rochelle. And so just to let folks know, gives you some comparisons. So it looks like this afternoon, the area where people are doing the most around self-care, it looks like it's in the mental health and emotional support, and then the social people connectiveness, where they both had 68%. The next one is at 64%, the spiritual health. That was at 64%, and then physical health was 61, and improving my lifestyle was 42. These numbers are a little bit different than the morning. In the morning, approximately three out of four folks reported the highest one for them was the physical health. So we're a little bit different there, but we both groups agree in that the one that we're doing the least to improve revolves around our lifestyle and improving the lifestyle that we lead. So let's actually go ahead and look at self-care plan. And in this next slide that's up there now, let me say a couple things up front about your self-care. A self-care plan is not a one-size-fits-all, okay? So the self-care plan I'm using right now wouldn't be the same as for a colleague of mine or a loved one of mine, that everybody's going to have their own self-care. So no two self-care plans are the same. The second important point or key I want everybody to reflect on is a self-care plan is not static. That once you create it, you never come back and look at it. You try it, but you don't look to see the effectiveness of it. So you want it to be dynamic in that you may be doing some activities under physical health or mental emotional health, where some of those activities are working, but the effectiveness of those strategies may go away after a while. And if that's the case, then you replace those activities or those strategies or habits with a new one in that area. Okay, so those are two key points up front, that one size doesn't fit all, and that your self-care plan is not static, it's dynamic, and that you'll need to kind of keep revisiting it as with new activities or new strategies, because some of those strategies will lose their impact or their effectiveness over time. So actually, let's actually go into some of those. And probably if I would have done a poll already, some folks say, yeah, here are some of the ones I'm doing under physical activity that are working for me. But if we're looking at physical activity, most of these make common sense. Healthy eating, getting enough sleep. We talked about sleep hygiene already. Exercise, hygiene, medication, hydration, physical therapy. So many of us are already doing that. In the area of mental health and emotional support, emotional health, that's self-compassion, grieving. Now there's, with the approximately 250 Kentuckians died, so some of us know firsthand a family member or a loved one or a colleague or a client that's serving may have died by the COVID. And so we might be grieving their loss. But I also think this pandemic is causing a lot of us to grieve the loss of our lives up until this point, that we used to have our routines and our structures and our daily things that we do, and now that is gone. So we've had to readjust or recalibrate our lives in order to deal with the pandemic. So many of us are grieving the way we were living our lives up until the pandemic took hold. And then positive affirmations, self-love, and self-respect. As I mentioned, it's really important for us to give permission to not to have good days, and that we don't have to be perfect every single day. And I know for some of us that if we are caregivers to children or to our grandchildren, or if I'm a foster parent, I brought in foster children into my home, we are not going to be perfect every day. And so there may be bad days, and we just have to accept that and say, this is just a tough day for me today. And then hopefully you have some supports in place to deal with that, so you can support the people you're caring for. But it's really important that we recognize our own emotions and our feelings. We're not going to be perfect every day. If we go down to the next one, for the social people, supporting friends and family and supportive groups. And as I mentioned earlier, a lot of us do family meetings by Zoom. And I mentioned two examples of that might be playing charades, right? Or it could be playing family feud or some other way of family staying connected. And one of the other things I saw with some folks is, especially if you have children in the home, they're not able to actually talk to the grandparents in real time. We're doing Zoom, but I've seen some situations where people will get in their car and go to the grandparents' home, so grandchildren can see their grandparents, but they stay outside the house. So you have that barrier of the door, but they can still interact with them. And then they're writing each other signs or they're talking by phone. It's really important that we stay connected. And then also connected with friends. Two examples I've seen some folks do, and I think these are really great ideas, is the first one is some folks are doing happy hours on Friday afternoon at the end of the traditional work week. And so instead of getting together in the community at some place in the community, now they're doing it virtually. They're having happy hour on Zoom. The other one is some folks who have their faith on Bible studies on Wednesdays, and now being done by Zoom along with services on Sunday afternoon, Sunday morning. So they continue that social connectiveness, but they're using technology, whether it's church services or Bible studies Wednesday afternoon. And then the other thing, just how people are being creative around staying socially connected to others, is I know for some of us, Saturday was a big day. And I think this is the first time, and I don't know how long, that the Kentucky Derby was not run on the first Saturday in May. And so what I saw, a couple things, in my community where I live on my block, I live on a cul-de-sac, and every Derby, we all get together in the cul-de-sac, and we have a big barbecue, and all the neighbors and all the kids and grandkids, we all get together and we have a great time. Now, we weren't able to do that this year in social distancing, but what I've seen on social media and Zoom, that people were actually having Derby parties on using Zoom. And I thought that was a really cool way of staying connected with our friends and our loved ones in Zoom. And then the last point about Derby, which I thought was really kind of cool, was even though they didn't have the Derby Saturday afternoon, I guess through technology, they were able to show a Derby race with all 11 or 13 Triple Crown winners. And they did a race, and people were able to cheer on their favorite Triple Crown winner. And I think for folks who didn't see it, hopefully this is not a spoiler for you if you want to YouTube it, but Secretariat won that race on Triple Crown. I don't know how they decided it was Secretariat was going to win, but I thought that was a nice way of trying to keep Derby in everybody's mind, staying connected for everybody. And then flipping over to lifestyles, routine, and relaxation and pleasure. Some of us have some guilty pleasures. It may be, if you need a little respite for yourself, it may be a bubble bath. Or if you like chocolate, you may have your favorite chocolate. Or you like reading novels. There might be a particular kind of novel I call cotton candy novels, where most times you shouldn't just be reading that, but if you need to do a little relaxation, you pick up one of those cotton candy novels for whatever genre that you like, and it makes you feel better. So it's really important that we do some relaxation strategies, whether it's trying to receive pleasure from them. And then finally, over to the bottom left side, what we're looking there is spiritual side. And I mentioned some of these already about going to our houses of faith in our churches, and going online. Many of the churches are doing those online with FaceTime or YouTube. That's a really important thing. And then meditation. Another thing a lot of the churches are doing, many of our families in our community revolve around food pantries, because many of our families, the primary caregiver or breadwinner lost their job. So now they're trying to scramble food. So I know many of the churches are taking the lead in some of our communities to do food pantry. That's another way of addressing our spiritual needs or our spiritual side of ourselves that we're helping others. So those are some of the key pieces to self-care plans. And please, when you reflect on this presentation after it's over, you may have more things under physical and may not have as much under social, people, or mental health, emotional, which is okay. So you don't have to worry about that. But just as you're developing your own self-care plan, if this is the first time you're doing, or you're tweaking the one you currently have, just use this as some examples, because as I mentioned in the previous slide, self-care plans are not static. What I'd like to do now is talk about some strategies. And the first strategy, and you see it on the slide, is about mindfulness. And I know when folks registered for this session, there was a number of folks under some self-care practices. A number of people says, "Well, I practice mindfulness." So when I created this slide, I knew we're going to have a wide range of understanding around mindfulness. So I tried to shoot for the middle. So if you are a person who's been practicing mindfulness for a little while, I apologize, because the purpose of this slide is to give a foundational understanding of what mindfulness is for those folks who may have heard about it, don't know much about it, or for some folks where this is the first time they're learning about mindfulness. So if you look at the picture on the left, what I like about that is mindfulness drives to focus on the present. Being in the here and now is a major tenet of mindfulness. And then the picture on the left and the saying on the left reads, "Mindfulness is simple. Being simply being aware of what's happening right now without wishing it were different, enjoying the pleasant without holding on when it changes because we know it's going to change. And then the final portion of that statement is being with the unpleasant without fearing it would always be there because it won't always be there. So those are just some of the statements that revolve around mindfulness. And what I'd like to do now, Rochelle's going to show a video. It's a 3-minute video that gives you, for many folks, a foundational understanding of what mindfulness is. And as I mentioned earlier, if you're a practitioner of mindfulness, just please put up with the video for 3 minutes. So if you would, Rochelle, please play.
Welcome to Mindfulness Animated, a fun and helpful explanation. The brain has evolved so greatly that it spends much of its time solving problems that haven't yet occurred in the future, thus leading to anxiety or panic, and mulling over events in the past, leading to depression. Often it does both all the time. The question is, how can we make our brain stop and think about only the present, the state we are in when we are in the zone or in the moment? Mindfulness is derived from the Eastern meditation, a practice for thousands of years recognized to help humans control and tame our brains. Research has shown that, among other things, meditation can help depression and anxiety, reduce stress, reduce pain, while improving concentration and giving us more energy. Meditation has also been shown to improve relationships, increase creativity, boost immunity, and may even prolong life. The question is, how do you do this? Simple. This 3-step approach is all you need. For 15 to 25 minutes every day, number 1, sit up. Number 2, close your eyes. Number 3, concentrate on your breathing or repeat a sound or word. And each time you notice that your mind is wandering, bring your thoughts back to your breath or sound or word. And if it wanders again, just bring it right back. Keep doing this until your 15 minutes has passed. I would use a meditation timer app on your phone or any timer. The more you do, the easier it gets. Many people notice their breathing slow during mindfulness meditation, and sometimes respiratory rates reduce dramatically, but this often confers benefits on mood and anxiety. Remember, each day will be different, and some days will be easier than others. Over time, you will notice that your mind wanders less, or that you can control it more as you begin to accept that it naturally wanders, but that you can bring it back to the thought at hand much easier. Once this happens, you will notice how much more time you have as your brain finds itself enjoying the present, the birds singing, the smell of the flowers, and the color of the leaves. And you may start noticing subtle smiles and looks from people all around you. Welcome to Inner Peace. Thank you for watching, and please subscribe now.
Okay. So just as I mentioned, this is a foundational understanding of what mindfulness is. And at one point during the video, it talks about maybe practicing it daily, 15 to 25 minutes. When I first started to do mindfulness, I couldn't do it that long. It may only be about 5 minutes where I was able to focus and stay in the moment and staying centered and without losing my attention. So although they talk about 15 to 25 minutes daily, don't beat yourself up if in the beginning you're not able to do for that long. It's a matter of growing and learning how to control your mind, stay in the moment, and not be distracted by other thoughts. So mindfulness is a strategy that folks are starting to adopt more. In fact, if you are an educator or a person who works with young people, whether it's children or teenagers. A lot of folks now, especially educators, are starting to embed mindfulness practices in their daily routines at school. And so I know some educators are doing that, and I know some out-of-school time providers and some early childhood providers are starting to incorporate mindfulness strategies in their work when they're working with young people. In the next slide, I want to share a couple more resources with you before the end of our presentation today. And these are two apps that are on your phones or your cell phones or on your tablets that you can go to. The one on the left is Calm, and the one on the right is Breathe. And those are two apps you can do to help do some mindfulness practices or breathing activities and meditation. So they're free, and those are just a couple of examples. There's many more out there, but I just want to give you a couple of examples. And then let me go back to the previous slide. Other resources we've talked about for most of this presentation is about self-care for ourselves and dealing with the stress associated with COVID-19. But I know many of us are parents or grandparents, and we're caring for our children or grandchildren, or we're also professionals, whether we're an educator or we work for DCBS or another where you work with young people. There are a couple of great resources available to help you as an adult who interacting with kids, dealing with the stress kids are experiencing during the COVID pandemic. So the first website is called the Child Mind Institute, and that website is childmind.org, childmind.org. And that it's a national association that's dedicated towards transforming the lives of children and families who are struggling with mental health and learning disorders. But what's really nice about that website, it gives parents and teachers or educators or other adults who are providing services to kids strategies to help kids deal with the stress associated with COVID-19. The second one that's focusing also on kids comes from the National Child Traumatic Stress Network, and their website is nctsn.org, nctsn.org. And they also have a lot of good resources for teachers and parents to help kids deal with the anxiety around COVID-19. And then the final one for kids is on PBS. If you go to the PBS, the public TV folks, they actually you can sign up and you get a daily text. And this is more for the early childhood, from birth to 6 years of age. So if I'm an early childhood teacher or I have very young children in my home, you'll get a text each day. Here are some things you can play with your child to deal with the COVID-19. It comes up with activities. Now with COVID-19, many of us didn't go to school to become teachers, but we've been forced into the situation of being teachers, providing homeschooling for our children. So that's really important. And then on the next slide, these are just some resources. And there's many more than I list here, but the reason why I put these up here is for a reason that if you go on the internet, there's a lot of good information that's research-based, but then there's also some stuff there on some questionable websites, okay? So it's really important that you be very mindful of where you're getting the information. And I'll use this as the example of a website that at one point during this pandemic, there was some people posting that the cure for the COVID-19 is the liquid silver. Drinking liquid silver take care of, that's the antidote, that's the antidote, or that's the cure us from COVID-19. And we all know, obviously, that that's not the case. So the purpose of this slide is to say you really should be using going to websites or using resources off the internet that have the research, they have the data, they have the information that's valid and reliable. So in the upper left-hand corner, I just give that at the national level, Centers for Disease Control, or CDC from Atlanta. They got some great information and the most current information about the progression of the disease, strategies to deal with that, and what we should be doing. The picture in the middle of that slide is Kentucky's COVID-19 resource page on their website. And the one all the way to the right is locally, that's ours here in Louisville, the Louisville Health Department. They put information out about COVID-19. So if you go on the internet, the important piece on this slide to remember is use research-based organizations or reliable organizations. Some of those are anything that's from professional organizations like the medical society or universities or hospitals or research institutions or governmental agencies that have the research behind it. and we don't want to be sucked into some of those other web pages or Twitter sometimes say, oh, we found the cure to COVID-19. That's example the one I gave earlier, drinking liquid. And then obviously Bounce is also a resource available. Then anytime I do a presentation that revolves around suicide prevention, about mental health and self-care, we always talk about suicide prevention. Usually if I was doing this presentation live, I'd ask everybody to take out their phone and please put this phone number in their contacts, in their phone. Hopefully you'll never need this, but if you're ever in a situation, whether it's yourself or a loved one or a colleague or a friend who might be suicidal, it's great to be able to pull up the hotline and then get that resource quickly on your phone. So, that number is 1-800-273-TALK, 1-800-273-TALK, or TALK is 8255. So I include that as a resource to you. Hopefully you'll never need it, but it's there if you do. Okay. I know at this point we're going to spend just a couple of minutes on questions, and I think we've had some questions that I've seen, and then, Rochelle, I'll ask you to add anything else. But on some of the questions we've seen, looking at this, myself and Dr. Lynch, is trouble transitioning between the balance in life, hard to leave work at work. And so I know an example of that might be many of us are now working from home, whereas we used to go to the office. And so my suggestion would be in that situation, identify a location or a room in your house or your apartment that is your workspace now, and that's what you use that for. Because I think a lot of us, as many of us are adjusting to working from home, sometimes today I may be working from the dining room table or from the kitchen table or from my bedroom or from the living room. It's really important to create those routines that I talked about earlier in the day, early in this presentation. So it's important that, try, if at all possible, identify a location in your house or in your apartment that's for work only if possible. The second piece about leaving work at work is many of us may have worked, work hours were from 8 to 5, but now that we're working at home, there's much more flexibility. But I do encourage you to try and establish a routine where you're working certain times of the day and as much as possible try and stick. That kind of leads us to the next question about tips on how to stay focused when working at home. Now, there's many more distractions at home than working in the office where you used to work or an agency where you used to work. So, but it's hard to be on the phone or doing Zoom meetings 8 hours a day or 6 hours a day, or if we're an educator providing lessons. So it's hard to be looking at a computer screen for 8 hours a day. So it may be, I know with the way I am in my attention span, I can only go for 30 minutes, but then I have to take a break, okay? So it might be, I step away from the computer screen for a little bit, and I go get a snack, or I do a quick, breathing exercise, or I take a quick walk. So it's important to stay focused. You got to make sure, you're taking care of your physical needs and your social emotional. Okay, so work what you need to. If you can separate into a separate room or area in your house or apartment, that's great. But then also try and establish work hours, just like you would do if you were in a typical situation. Another question that one person mentioned earlier was having trouble doing Zoom socialization with loved ones. And this individual, I believe, to be a therapist, where they're doing telehealth. So they may be, for much of their day, they might be doing counseling services or interacting with a client. And this could be teachers who are providing lessons also. It'd be important to be able to separate that, and may not have the energy to do Zoom meetings. But if you're going to be doing Zoom meetings with family, I mentioned a couple already, playing charades, but another one might be playing bingo, with family members, or having a family dance party. So that's another example of things that we can do to kind of overcome the use of Zoom just for work-related activities, but also making that connection with family and loved ones. Okay. So those are some of the comments and suggestions people have in answering some of those questions. I know we're coming to the end. Rochelle, real quick, was there anything else? Was there another pressing question that somebody had that I didn't address at this point?
Nope, no additional questions.
Okay. I just want about what types of exercise works best for people. And I think any exercise where you have to build up your endurance a little bit but it doesn't have to be running at at full pace. For some of us, increasing the heart rate may just be a good brisk walk. So that's really unique to everybody. But you want something that raises your heart rate as long as you're in good shape. And then it doesn't have to be for an hour. It could be 10 minutes. But just doing something that increases your heart rate and it's not painful to do on yourself. So with that being said, I just want to go to the last slide. Is the evaluation of this training session. Bounce takes it takes very seriously the feedback we get, especially now that we're doing them on virtually. So in just a short time, you're going to receive an email from us about today's evaluation, our session today. And I really would appreciate if you would take a couple moments to complete the evaluation, because I will take the information that you share with us. It's confidential. I won't know who sends it, but then it'll help me be able to tweak the presentation. So the next time I give it, it'll be a better presentation. So please take a moment to complete the evaluation that you'll be getting. And there's Bounce, and I just want to say thank you from the Bounce folks for giving us the opportunity to have this presentation with you. And I wish everybody be healthy and safe. And I'm going to turn it back over to Rochelle. I think she has just one or two comments left.
Thanks, Dr. Bargioni, for your presentation today. And thank you to everyone who was on this call. I saw the list of people. I know some of you, and it will be great to see you in person soon. Thank you for joining us today. I will be sending that email evaluation to your email this afternoon. Also, thanks to Bounce team member Dr. Beverly Winch, who supported this webinar today, and my colleague Amalia Mendoza. It does take a team to do all these things. The slides and recording will be available soon to you, and I will send you an email with those links. Thank you, everyone, for joining us today. Take care of yourselves, and I look forward to connecting with you very soon. Have a great afternoon.